Good afternoon, everyone. I'm Aaron Level, the Vice President of Communications and Public Affairs. Welcome to today's Hamilton Health Sciences virtual town hall on January the 7th. We have a lot of ground to cover today. I know that we will have lots of questions around many topics. Surely at the top of that list will be some around the process for the rollout of the COVID-19 vaccine. We did have a town hall yesterday and had the opportunity to address many questions. Just wanted to ask everyone today, we are going to talk a little bit more about that topic and the work underway. You'll have the opportunity at the end of the webinar to ask questions, but maybe just reserve those until you've heard the content and use the Q&A box at that time. We'll specifically recognize that moment in our agenda just to make sure that in the course of the presentation, maybe the information you need will come up and we'll address it then. I know a lot of people are really distinctly interested in the topic of the sequencing of the vaccine and individual questions. Today's probably won't be the forum to address that, but I know Leslie Gauthier, who will be talking a little bit later, will be providing information about how to get unique information about specific circumstances for individuals as it relates to the sequencing. So a lot to come on that topic. I'm going to introduce Rob McIsaac, our President and CEO, to kick things off after that small bit of housekeeping, and I'll be back later to moderate our Q&A. Rob, over to you.
Okay, thanks very much, Aaron, and good morning, everyone, and thanks for joining our second town hall this week. Yesterday, we had one of the largest town halls we ever had with about 1,600 staff and physicians and learners in attendance. That's probably not surprising as the focus was on vaccine distribution to people working here at HHS. For those of you who weren't able to join, maybe I could just start by reiterating that we are doing everything possible to get the vaccine to you as quickly as we can. This week, we are starting to accelerate the distribution of doses that we have on hand. Frankly, the future of the vaccination program is very much dependent on our supply chain. We're hopeful, based on discussions with General Hillier and others in government, that shipments of the vaccine will increase in the coming weeks. Starting today, we began the scheduled rollout of the vaccine to everybody at HHS. I would just really encourage people as strongly as I can to get the vaccine. I've seen the modeling for the province looking ahead, and the trajectory of cases about the continued spread of the virus is not very hopeful at the moment. Instructions about how to sign up and details about the sequencing or the order in which people are getting the vaccine was sent out yesterday via email and through the Daily Dispatch. This information is also available on the HHS website and is being shared extensively on our social media channels. Maybe I just pause to say and give reassurance to everybody in terms of that sequencing, that we have done our very best to come up with sequencing that is fair to all involved. In that regard, I can say that for me and for the senior team, we are based on the kind of framework that was produced. We are in the last category in terms of people who are going to be getting the vaccine. That holds true for most of the senior team. So we will, I expect, to be submitting our names into the randomized process in accordance with that categorization, and we will be living by the same rules as everybody else. You can watch a recording of yesterday's vaccine distribution town hall if you want to learn more about the vaccine and what we said yesterday. Once again, we're moving as quickly as we can to get this done, and we anticipate that everyone who wants the vaccine will be able to get it by the end of March or early April. Of course, again, I'll just reiterate, it all depends on the supply of the vaccine. So I'm hopeful that supply will not only firm up, but also increase in the weeks to come. I think I will turn it over to, I believe it's Sharon Pearson and Dr. Mertz, who are going to um, take over from here. I know there's been lots in the media about certain civic and health leaders in the recent days. I just maybe could assure everybody that the senior team has also stayed close to home over the past months for what it's worth. So Sharon, over to you.
Great. Thanks, Rob, and good morning, everyone. Wanted to provide an update today on our hospital operations and how we've been doing since our previous update. And sadly, this sounds a little bit more like my previous update that I provided at the town hall with respect to our occupancy pressures, but certainly it's unwavering. We did see a bit of a reprieve over the past week because of the surgical slowdown, but certainly since Monday, we're on that steady rise and our occupancies are well above 100% at our adult sites, as you can see on the slides there. And certainly this is revealing itself as we would expect in terms of having lots of patients in the ED with long lengths of stay and affecting our system partners as well with ambulance offload delays. And of course, you know, the contributor to this is the COVID situation that we're in, and we have seen the highest number of cases of COVID coming through the ED and related to outbreaks in our organization since the beginning of the COVID journey that we've been on, and we'll be hearing more momentarily from Dominic on that trend and where we're going into the future. The conversations are unchanged from what I reported previously too. We have lots of regional conversation, lots of Hamilton conversation about how we can do better. Both working with our community partners to provide supports for the population at large, and also how we can do better amongst the hospitals to ensure we are not putting an additional burden on any one site. So I can assure you there are frequent daily, multiple daily calls as we try to maintain the best access as we can across our organizations. A lot of attention is to scheduled care and not wanting to jeopardize this service that we provide, critical service. There is a lot of attention for Hamilton Health Sciences in the regional programs that we provide. And Steve Kelly, along with Les Gauthier, are at a number of tables really advocating for the ability for us to really optimize access for all of the patients across the system. We do always have to be prepared for that additional reduction in scheduled care. We never did get back to our pre-COVID volumes. We've been around 85%. We do, and we are trying to ramp up in this upcoming week. But again, it's a day-to-day conversation that we need to have. And I'll just go on to the next slide. In terms of the outbreaks, and I would refer you to the hub for the recent updates on the outbreaks at the JH, the HGH, and unfortunately the most recent at the satellite health facility. We did make a decision around the Juravinski last week related to the need to have an outbreak unit. And our initial efforts were to try to move all outbreak related patients from the Juravinski. But as volumes have increased and the number of communications and patient transitions increased, it became more of a high risk process. And so we did make that decision and opened an outbreak unit on M3. It does not make the Juravinski a designated regional COVID site. The 4 COVID sites remain in our region for HHS, that is the Hamilton General, and then we have St. Joe's, Joe Brandt, and Niagara. But we will be able to manage our outbreak patients within the M3 unit. I would want to say a huge thanks that the burden of work associated with managing these outbreaks has been inordinate. The moves that have been required, the transitions that have been required is substantive. So a huge thanks to the many, many individuals that have been involved in trying to resolve the outbreaks that we've been experiencing. And the next slide, please. In terms of, mechanisms that we're trying to mitigate the risk of the pressures on the hospitals, you would have seen in the media and then through some of our own comms that the pandemic response unit did open at Joe Brandt this week. Yesterday, the first 2 patients moved and there'll be additional patients today. HHS will be part of the assessment of patients to transition to the pandemic response unit. And through Deb Bedini and Louise McRae, we're working through our internal processes and how we will make those assessments about the appropriate transfers to the PRU. I don't think anyone would be surprised to know that we need to play a role beyond HHS, and we're doing that now. But as we see the pressures increase to the east and to the west and our own pressures, we will have to think a bit differently in terms of the role we play, not only within our region, but outside of our region as well. And the next slide. In addition to the occupancy pressures, we know the overlay is not just the bed pressures, but the staffing challenges that we face. We have draws on our staff related to the outbreaks, our regular seasonal illnesses that we have this time of year, and then also we have the support we're providing in our community and also with our vaccination clinic. So there's a number of draws on very finite resources that we have. There is some good news in the way of the Grace Villa. From a staffing perspective, it has been a very sad and unfortunate situation that has occurred there. But through the leadership of Les Gillies and Kelly O'Halloran, we have really worked to support the Grace Villa. We have seen about 50% of our staff return from the Villa back to HHS. So another thanks out to the staff that were deployed there to support Grace Villa during a very challenging time. We still have our management order in place, and we'll have that for a number of months and continue to help steer Grace Villa in the direction that best supports them and their residents. We continue to support other congregate settings in our community. Sadly, these outbreaks continue. We still do need volunteers. So again, we provided the contact email if anyone would like to volunteer. We appreciate there's a balance that needs to happen, and people have their home unit accountabilities as well. But if anybody wants to talk about opportunities, please reach out. So I'm happy to take questions in the Q&A around operations. And I think with that, I'll hand it back to Aaron.
Thanks very much, Sharon. Up next, I'm going to ask Dr. Dominic Mertz, our Medical Director of Infection Prevention and Control, to give a bit of an update as to where we sit in terms of the pandemic, and there's also lots of news media about the new variant arising out of the UK. So I think, Dominic, you had planned to touch on that today too. So over to you.
Yeah, thanks, Aaron, and good morning, everyone. You're all familiar with the figures I'm showing you. You may not remember the numbers, how they looked like the last time around, but for Ontario, certainly they were much lower. And when I'm showing you the Hamilton data specifically, the same would apply. So this is data as per yesterday. Again, in the bubbles, you see the cases per 100,000 per week. So it's comparable from province to province. And in the arrows, you would see the RT. And again, an RT of more than one means that the average person infects more than one other person, which means that over time, your number of cases will increase. While if it's below one, obviously, the case numbers will or had been coming down and will continue to do so most likely over the days to come. You see Ontario sitting at 147, so that has certainly increased. Quebec with 213 now, the province again with the highest rates and a significant increase similar to Ontario over the last couple of weeks. While Alberta has been coming down more recently, it's now sitting in a similar ballpark as Ontario does. And then the other provinces and territories lower, much lower than where we sit. Nunavut, that had an issue a few weeks ago, is back to zero. New Brunswick seems to be struggling a little bit right now with 9 and a relatively high RT. So let's see whether they can continue to contain transmission in their province. Next slide. So that's the epi curve, and the blue arrow there is our holidays. So it's Christmas Day, just to give you an idea of how those things correlated within Ontario. And I think the reason why you see a reduction there is Probably not because we had a true reduction in number of infections. Probably people didn't go out and get tested because it was over the holidays. Then some catch up happened, and most likely what we are seeing now and likely continue to see over the next week or two, maybe the impact of social gatherings over Christmas, New Year. Next slide. This shows you the number of hospital admissions in the province, wave 1 on the left-hand side and our second wave on the right-hand side. And as you can easily see, we now have more COVID patients hospitalized than ever before during wave 1. The same, or I would say a similar ballpark when you're looking at ICU patients, which is that dark black small piece in there. And certainly it doesn't look like we have peaked yet. And when you're looking at the case numbers, you would expect the hospital admissions to continue to go up at least for another couple of weeks at this point of time. Next slide. The more local picture looks very similar to what I've shown you with the provincial data. We had that sort of gap where it looked like, oh, actually cases are coming down over Christmas, but again, most likely only because people didn't go out and got tested. And then now we have that increase after the holidays. The gray bars, just a reminder, those may still get larger because we may not have all the cases captured yet. Next slide. Hospital admissions within Hamilton now for the first time exceeded what we had back in spring during the Roslin outbreak, where we had that big increase to 70 at some point. So we are on average 75 for this week so far. And again, the same that applies for the province mostly will apply here as well, which will be that it's continued to increase at least for another couple of weeks, even if we are able to reduce number of cases over the next week or two. Next slide. Then people ask a lot of questions, as Aaron already mentioned, about the UK variant in specifically. There's also the South African variant. I will not go into too much details there. There's also other variants out there that aren't probably not as important, but the UK variant is certainly the one that's triggering reactions, I would say, across the globe, with shutting down travel to the UK is again, UK being in a very firm lockdown again, with the main rationale being this B.1.1.7 variant. It was first identified in the UK. Nobody would say that it's necessarily that it developed or came up first in the UK. Chances are it did, but just keep that in mind. So don't blame the British for this variant. There's a total of 17 mutations in this variant, not all of them in the spike protein. I just make it a little easier here. The spike protein are those spikes that you see in the picture left to my headshot on the slide, which is the main target of our vaccine as well, which is the protein that interacts with the ACE receptor, so a very important piece of the virus. In Ontario, as far as I know, we have identified 6 cases so far. All were travel related. So there's probably still a chance that it's not out there to a large extent yet and may be contained, but nobody really knows because we don't do a lot of sequencing on a regular basis, and you don't identify this without large amount of sequencing happening, which the UK is doing, and that's why they have such great data to share. Now, what's the bad news about the UK variant? So there's certainly a correlation between increasing case numbers in the UK since it was first identified, which was back in September. And this variant became the predominant strain, which suggests that this strain transmits more easily than other strains. That's why it becomes the predominant strain. And the early data suggested that it may increase your R, so the likelihood of transmission, by 0.4 to 0.9. So putting that into the context of Ontario, if this holds true, we are certainly sitting at around 1, that if this variant was the one we would be dealing with, and if those estimates hold through, we would suddenly be at the 1.4. That's very theoretical, because most likely the vast majority of what we are dealing with currently is not this specific variant. And that increase in R, which people now agree is probably in the range of 50% increase, still comes with a lot of uncertainty. I think that's important to mention as well. It's just the best estimate at this point of time. There's also talk about correlation with higher incidence in children. So that's certainly what they observed in the UK. But you have to take that into the context that this occurred during a time period in UK where there was a lockdown with schools open and everything else pretty much shut down. So of course you would see relatively more transmission within schools than anywhere else, because anywhere else is largely shut down. So again, it's unclear at this point of time whether children are truly more susceptible or more likely to transmit this variant than others. So again, more to learn, but that's the concern out there for sure. Some good news as well. It doesn't seem to be associated with more severe disease. So it doesn't seem to result in more hospital admissions, ICU admissions, or death than the other variants that we are dealing with. And the vaccine most likely still effective. Do we have great data? No, but that's what's being suggested, because it's still a relatively minor mutation of that protein. And as such, the expectation is that it will still be effective. I stop here. Thank you very much, and happy to take questions.
Thanks very much, Dominic. Now we have time for some questions. I wanted to ask, though, I know, again, and as I said at the outset, there are many questions related to the vaccine. Some of those are, individual in nature, about people's position in the organization, how they fit into the sequencing. I wanted to ask Leslie Gauthier, who's really been involved in the work of the sequencing with others to kind of noodle this topic, to maybe, Leslie, you could, I know in the last 24 hours, we've been dealing with a lot of questions and responding to lots of inquiries. Maybe you could give a little bit of insight off the top, and hopefully that would cover off some of the questions that people might have lingering in their mind before we go into the formal Q&A.
Sure. So thank you. And I just like to start to say, I think it's been a really, really exciting day for Hamilton Health Sciences and St. Joe's, as we were able to formally launch the process for people getting their vaccinations. A tremendous amount of work from both organizations, and a lot of people have really stopped. A little bit to Rob's comment about vacations. This really did take over the end of the Christmas season as we put this work into place. So first, most important message that I would have liked people to have heard yesterday is that everyone between the organizations who wants a vaccine will get a vaccine. The conversation needs to be put in the context of sequencing and how do we try to first sequence to those people who are most at risk of getting COVID. And this is the highest risk. And that was a lot of the questions I've fielded in the last 24 hours. It's not about on my unit, there's been 1 or 2 patients. The real focus is to people every day who are caring for high-risk COVID patients. And the second group that's included there is for our physicians and health professionals who are participating in aerosol generating medical procedures. And there's a very clear list of what those procedures are. High level, it's the intubation of patients, it's bronchoscopy, it's brachytherapy in the cancer center. So that is our targeted highest risk group. The second group is for any of our care teams who are caring for our most vulnerable patient populations. And each of us will have some degree of vulnerability. It's really focused on the highest risk. And again, our cancer patient populations, specifically hematology, The renal transplant and dialysis populations are a second group that have been listed there. And obviously, as we're all aware, are frail elderly populations. The third grouping is for everyone else across the organizations who are forward facing and taking care of patients. And that's where that risk of, I get asked to do a consult and I might go to ED and see 2 patients. If you put that into scope of the greatest risk is in the first group, we're acknowledging lots of people in the third group have a risk of exposure. It's just not the highest risk. And then the fourth group is everyone who, to Rob's point, are administrative leaders, people who work in quote back offices where they're not interfacing with patients and families every single day. So as we put that framework out, we received a ton of questions around a specific role. The tool was not meant to list every role across HHS. It was really meant to help you as you check off and put in your submission to be vaccinated, that you can look at the tool and say, okay, where do I think I fit in this framework? It's super dependent on your own ethics as to how you check off which box that you are in. Second or third comment I'd like to make is we had fabulous response yesterday. So the last numbers I have is we have 5,975 staff, physicians who have submitted from HHS and almost 2,400 from St. Joe's. The randomization is with both organizations together. I'll start with an apology. We know yesterday that everyone didn't get the confirmation text, and that was just the system got so overloaded. So what we do know on those numbers I gave you, there's a fair number of duplicates where you didn't think it went through, so you clicked again. The IT team who is working with us on this tool, who worked 2 very long hours last evening, they're going to establish a process and actually be going through, and we're eliminating all of the duplicate records. Equity, we want to make sure everyone has one record in the lottery and people don't have more. So that process is being established for us today. The next point to go on is that a lot of questions were asked around our university colleagues. And we're answering back in 3 buckets of teams. So if you're a university employee and you're forward facing with patients, you're going to pick the appropriate group 1, 2, or 3, dependent upon the risk. So if I use the example, if you were an administrative assistant and you work in the hematology clinic and you're seeing hematology patients every day, you're going to select group 2. If you're a university assistant and you're working with a surgeon in a surgeon's clinic, you're most likely picking the 3rd grouping. If you're a university employee and you're in a back office space and you are not interacting with patients, you fall into the 4th grouping. I have met with Claire Mitchell from the university this morning, and we're going to put some clarity out in communication to the university to address that issue. And the last comment to make is how do people escalate where you have concerns and need clarification? As I stated yesterday, Dr. Helen Flagiola and myself are very happy to field individual questions. If you have a personal health information question, this process is not intended to deal with a framework that would sequence any individual at HHS against another individual. You need to either take your personal health question through employee health, but remind everyone, and I go back to where I started, the real intent is we'll have almost everyone vaccinated early in March. So this is not a matter of if you'll get the vaccine, it's to the matter of when. And then my last comment just to make is a number of us volunteered last night, and we had the privilege of making phone calls to over 500 people that got scheduled into clinic today. I've shared with people, it was one of the most rewarding experiences I've had in a long time. absolutely could tell the how grateful teams were to be getting notified that they were being vaccinated today. People were exceptionally appreciative, very emotional, lots of those calls, which really kind of reassured us that we're doing the right thing and we prioritize this work. And I could tell everyone was really trying hard to work with us and accommodate the scheduling and the appointments. So sincere thank you to all of those that we've spoken to in the last day. And as we ramp up the clinic, so we're, 700 is our target for today, 500 to 700. And as we get to 1,000, we're going to get people booked in really quickly. We just really appreciate your cooperation with the process, and it's bumpy because it's happened really fast. So I'll stop.
Thanks very much, Leslie. I know I can see a couple of questions that have come in, and I know last night, as things were getting ramped up, we were ironing out some of the kinks. If somebody registered but maybe didn't get the text or the email confirming their registration, what steps should they take today?
They're still in. So we ran a number of them through with the help of the programmer. You can resubmit, and we're going to have a process. If you're duplicate, we're going to eliminate your duplicate records if that makes you feel more comfortable. But what I was told by the programmer, and I don't know, Michelle's on the line, if Michelle's heard anything different, as long as you click that submit button, your name got put into the lottery.
Good stuff. Thanks, Dave. I see you popped up. Did you have something to add there?
Yeah, we're going to look into see if it's possible to resend confirmations. Don't know if it is or not, but the system was overwhelmed yesterday, and I know so many people are asking those questions. So we'll see if there's a way to handle it. If there isn't, then there isn't, and I would follow Les's advice, which is if you're in, you're in.
And I wonder if maybe, Leslie, you could comment, maybe Dominic, you could comment. I know right now the direction from the province is to accelerate distribution regardless of supply. And we're getting as much vaccine in people's arms as we can. I guess the question is, what's the effectiveness of the vaccine between first shot and second shot, at least of the Pfizer vaccine? And is it possible you could get COVID in between those two shots? And if you did, what would be the impact of receiving the second one?
Yeah, I think if I knew the answer to your first part of the question, I will probably work somewhere else at this point of time. We don't know, right? The studies had been done with a given time period between the two shots, and we can only hypothesize what may happen if you change that interval to a longer interval. And that's the risk that we take by vaccinating as many as we can at this very point of time, because we do not necessarily know for sure that we will have in time the supply for the second dose. I think the only vaccine where there's some data around how that interval affects efficacy is for the Oxford vaccine, where it actually looks like with a longer interval you may have a better efficacy than with a shorter interval. But that's a very small subgroup analysis, not strong enough to draw any conclusions there. And we don't have any data like that for the Pfizer or the Moderna vaccine, as far as I know. So the easy answer is we simply don't know at this point of time. Many people have come up with some models showing it's better to do everyone first. Others say, no, make sure that you keep 10% back. It depends on what assumptions you put into the model, and then one approach A or B proves to be more effective at the population level. Bottom line is there's a lot of uncertainty out there because simply we don't have the data at this point. I think the call the province made, in my personal opinion, was the right one to vaccinate as many people as quickly as possible. But there's other opinions out there, and everyone has their valid arguments as to why it should be A or B. The second part of your question was?
I think it was really around, would having COVID preclude you from getting the second dose? I might add to that, while I've got you on the hot spot, what if I received the first dose of the Pfizer vaccine, but not the follow-up dose? Would it preclude me from getting the Moderna vaccine, or would it be recommended that I proceed and get the Moderna? So COVID diagnosis impact on vaccination, and then one versus the other in succession?
So COVID diagnosis is mostly an operational decision. Again, we don't know how the two interact, whether we don't know for sure how long immunity from the virus lasts, and we don't know how long the duration of the vaccine lasts at this point either. The recommendation by the federal committee was to say if you have a shortage of vaccines, to postpone the vaccination of those who had a confirmed infection, because based on a very recent study in healthcare workers, it looks like at least in the first 6 months after natural infection, your protection from a reinfection is probably as good as with the vaccine. But it's mostly an operational decision whether you postpone vaccination of those with a confirmed infection or whether you just go ahead. There's, in my mind, no biological plausibility, I would say, to say someone who had an infection may not respond as well to the vaccine, and probably the vaccine will be as efficacious as in others, but they already have a baseline immunity, but we simply don't know how long that would last. Hence, the recommendation is to eventually vaccinate everyone.
Thanks very much, Dominic. I want to acknowledge that I know Patrice and Kara both have their hands up. I just want to ask a couple of more aggregate vaccine-related questions from our Q&A, and then I'll go live to you next. I guess, Leslie, from an operational standpoint, one of the questions that's come up in the Q&A box is if an appointment be scheduled during work hours? So can somebody who is called on, will they be given leave to go and get the vaccine during a shift?
Right. So absolutely, as we're calling out for people, we are trying to accommodate, you know, if I call you for today or tomorrow, what works best for you. I will say from personal experience, a lot of people we were able to accommodate at the start or end of their shift. If you are taking an appointment when you are at work, the ask is that you let your manager know as soon as possible. And we are all committed to trying to get everybody over to the clinic. As I say that, it's for the general people, it's across the street. If you're coming from McMaster, it's travel time or another site. So it's the conversation with your manager to ensure they can get you there. So that's the short answer. And happy to accommodate people. We're running 7 days a week. There's weekend appointments. I saw in the chat line right now, the clinic is running 8 hours. And this was fast work to ramp it up. And there'll be faster work for Monday. And thanks to Nate and Lucas's team to go to a 12-hour clinic. So the hours are being extended. We need a few days to get there.
Good. I could see that in the Q&A too. Can you talk about the significance of choosing an honor system for selecting? And what if somebody actually inputted the wrong thing and recognized it later and wanted to correct it, or maybe prejudice their position in the sequencing by selecting the wrong thing? I mean, I know there's no perfect system. Can you talk a bit about the process that led us to the one that we have?
Yeah, so we had lots of discussion if we wanted to give, you know, frontline managers or leaders so many slots a day and have them doing all of the work of scheduling. And we heard really clear feedback that that would be super, super workload intensive when everyone still has their normal work to do. So the decision was made to let people self-select what priority you are in. There's 25,000 staff and physicians across the two organizations. So we do not have the ability to police it. I think each of us has our own ethical framework when we come to work every day. And I remind people, this is not about getting vaccinated. It is just about the sequence that will be done in March, assuming we have supply. So that was the decision that was made. And obviously, if you inaccurately put stuff in, I'm going to defer. I know Michelle's team is looking that we can create a mailbox or something for people to put individual inquiries in. We're not there yet. But again, happy if there's an error, just send it our way, send it my way. I'm happy to pass it on to the programmers to go back in and correct it. just out of interest, I made a few mistakes last night and they very quickly fixed mine. So easy to fix a mistake if it's in the system.
Thanks very much, Leslie. Others want to comment?
Yeah, Aaron, it's Dave. And just to, again, a thanks to everyone for their patience in the process and all the people working so hard to create a process out of thin air in a very short period of time. It's working quite well, notwithstanding there's the odd glitch, as you've talked about a little bit. We are looking to stand up a call center approach so that you would have one number to be able to call for questions. Just give us a little bit of time to get that set up. So that will help also when we get that going. And in the meantime, we're offering, folks like Leslie are offering, send her directly an email, as busy as she is. She's happy to help. So.
Great. Okay, so just want to acknowledge some of the questions in the Q&A queue are related to sequencing and specifics related to sequencing. We've addressed the process to seek information on that outside of this forum, so we won't address those right now. I think we've addressed the question related to process and notification, those that haven't gotten the text or email yet. We've also talked a little bit about the effectiveness of the vaccine between the first and second dose and then subsequently thereafter. I'm going to move off of the topic of vaccine, unless maybe Dave, Leslie, while I have you there, if there's something that you've seen that I perhaps missed that you wanted to comment on specifically. I don't want to avoid any opportunity to provide more information about this really important topic.
I don't think there's anything else, Aaron. Just, we are putting information and updating information on the hub regularly. So really encourage a slow, thorough read of those materials, and your question will probably be answered. And then if not, then absolutely please reach out. Again, patience, and I will reaffirm what Leslie said. Being able to call out and offer someone a vaccine and schedule events has been quite rewarding, and I know everybody wants it as quickly as possible. And there is a tremendous amount of effort and team behind all of this. You can rest assured this is a top priority for our whole organization. We want to get everybody a needle in arm. So great work to the team, and thank you for your patience, and look forward to getting everybody through the clinic as soon as possible.
Just maybe one detail for people. If we call you, we're calling to book an appointment today or tomorrow, but we also need to book that 21-day out appointment at the same time. So you really need to know where you're going to be at all times in 3 weeks. So the more readily you have that information available for the scheduler booking you in, the faster we can make more phone calls. So that would be just a really helpful thing. And you also need to remember you need to have your health card with you when you come to the clinic.
Great.
And a couple of people who said, I don't have a health card.
Yeah, don't want that disappointment. That's a great point. Thanks for the practical reminder. Maybe just touching on the topic of international travel, which I know was very prominent in the inbox between the last town hall yesterday and today. Obviously very topical in the media. As Rob iterated at the outset, none of the senior leadership team at HHS has traveled internationally. Many have not throughout the course of the entire pandemic. I'm just wondering, maybe Dave, you could comment. The question is, what's the position of the organization on international travel? I mean, it's obviously at the discretion of the individual. What does HHS think?
Yeah, I mean, it won't come as a surprise what I'm going to say, which is HHS would look to every individual here to try our best to beat this pandemic, and that includes following the public health guidelines that are put in place. So if there are specific guidelines around travel, then they should be followed. And that would, I can't presume to know everybody's individual situation, nor could our organization, but we would expect and hope that all protocols would be followed. And if there was travel for any particular reason, that the very strict processes for re-entering the country, self-isolation, all of those things would be followed. So we just expect our own organization to do our best to follow the very strict guidelines as put out by Canada Public Health.
Great, thanks for that. Well, I'm going to close the Q&A at this time to leave room for celebrations, conscious that we have 9 minutes until closing, and I think everyone could use a dose of gratitude and celebration in these dark times. But maybe, Rob, I can ask you to join me in leading that section of our agenda. And again, just want to reiterate that you can always submit any questions that you have to the HHS News inbox. And anything that maybe we on second review missed today, we'll do our best to get an FAQ posted on the hub as quickly as possible. So I guess now celebration time.
Hey, Aaron, I'm going to kick it off with the obvious one, which is to say a big thanks to Dave McKeag, Les Gauthier, Bruce Squires, Michelle Leaflor, and the many others who have come together to ramp up our clinic, to create and ramp it up. It's been awesome work, and it's taken place in very short order, much of it over the holidays. So anyway, I just think they've done an awesome job, and I'm really grateful to them.
And I think some of that's echoed in the comments in terms of appreciating the town hall yesterday, all of the work to get the vaccine process established, a very clear process. So some nice comments in there from individuals as well. Way to go, team. Dave, you were coming off mute there. Did you want to add to that?
Yeah, just piling in a little bit. Thanks for the effort of everyone yesterday who piled in as volunteers to give up an evening to outbound call in order to get today's clinic up and running. There were several execs on that group. There were lots of people from across the organization, back office staff. There was just a really nice camaraderie and volunteer approach, and a real genuine interest in getting our staff and St. Joe's staff vaccinated. So thank you for all those volunteers who gave up about 4 hours plus of their evening last night. And I know many of those are still continuing to, every time they have a few minutes, they're going in and making some calls to schedule some staff. So we saw that clinic get get registered for today. Was rewarding, but thank you for the effort.
Good stuff. Just a reminder to our participants, you can raise a hand in the participant section and we'll call on you to give your celebration live. You can also type something in the chat forum and Rob or I will read that out. I see Kelly Turner here with a hand up. Kelly, go ahead.
Hi there, I'm here with Susan Swayze. She's the geriatric nurse clinician here at the Juravinsky, and she's retiring tomorrow after 35 years in nursing. So congratulations, Sue.
Thank you.
Congratulations, Susan. Wonderful. Thanks for that, Kelly.
Aaron, Kim Alvarado put in a shout out to the engineering team at JHCC as they managed a serious power failure in a very responsive and effective way over the holidays. So I would agree with that. Great shout out and great work.
Great one here from Christy Mohide as well. Fantastic work getting the vaccination rollout set up. Thanks for the thorough and clear communication. Well done. Thanks for that, Christy.
Yeah, and Les Gauthier also did a shout out to everybody who volunteered last night to assist with vaccinations, or sorry, not just last night, but generally. So we will get better at making sure people are aware of the opportunities to volunteer, and we'll try to get a really slick system there.
Good. See one here from Kirsten Kroll, Diane Norman, and Allison Fox Robichaud in Student Affairs and Medical Education. Shout out, they did an enormous amount of work to handle the learners matters in relation to outbreaks with great support of Employee Health Services. Lots of our learners were tested and coached. The Master University Faculty of Health Sciences leads have been extremely helpful to work with Diane and Allison to map out the process to handle these complex scenarios. It was a really busy time for these folks over the holidays. So a big celebration of them for all that work.
Shout out. Yeah, go ahead. Sorry.
So it's Les. I just wanted to put a special thank you to the pharmacy team. People might have heard lots about mixing that Pfizer vaccine is not as simple as drawing a drug out of a vial. And it has been really rewarding to watch how the pharmacy tech team in particular under Chris's leadership have really come together to really support the vaccination clinic. So lots of people there. Just want to thank the pharmacy team in particular.
Very nice, thanks. Bruce, you had your hand raised as well. Did you want to call something out?
Thanks, Aaron. I really want to just celebrate and call out all the folks across HHS who provided care directly and who supported the provision of care over the holidays. Many of us got opportunity to spend time with loved ones, but many more of us continue to work and serve. And so I think we need to acknowledge, whether it's in our COVID units, whether it's in long-term care, whether it's in across each of the units of the hospital, emergency departments, and all of the support areas, we kept going throughout, and people worked while others in society were on holidays. So we made that possible. So I want to really celebrate all our teams.
Really important celebration, Bruce. Thanks for bringing that forward. I see a few more here, and maybe Rob and I can read those. Kelly, I noticed you came on camera though. Does that mean you wanted to jump in?
Yes, please. So I wanted to shout out to our logistics manager, Annette Lasavita, who has gone above and beyond, certainly over the entire course of the pandemic, not only assuring that all of our staff and teams have the PPE they need at HHS, but every time we come into a new facility or even the vaccine clinic, those all require stocking of supplies. And Annette has been tireless in her efforts, as has her team of supervisors at the sites, to make sure that we have the equipment to keep our staff and patients safe. So a big thank you to Annette. And then I also wanted to just acknowledge the team at JH and Ralph and Kim and their leadership as we've gone in and out of outbreak. A lot of it over the holiday period, people that were trying to be on vacation and get some time away with their families, only to be on daily calls to make sure, again, that we had the supplies we needed, that we were cleaning units appropriately, that as we emptied and went in and out of outbreak, that all of that happened seamlessly. It was a tremendous effort. And again, between Christmas and New Year's, a lot of it. So just a thank you to the CSS and logistics teams and their leadership.
Good stuff. Thanks, Kelly. So I see, Rob, did you want to read a couple of these?
Sure. I see a note from Roseanne Zimmerman to our infection control team, who's worked so hard throughout the pandemic. Totally agree. And then there's a shout out to the M2 staff and manager Danielle for staffing M3.
Also a shout out here from Dr. William Harper. Thanks to spiritual care leaders for their help with very isolated patients and with support frontline workers with meditation practices. Also here from Lisa. How will you communicate the call? Oh, there, that's a question. We'll get to that after, Lisa. Thanks for the question, but we'll stick with celebrations for now and make sure we get an answer to you after the fact.
Aaron from Andrea Frolic, I want to shout out to all the leaders across the hospital, from the front line to the president's team. Leaders are working long hours and weekends and holidays with a constantly changing context and pressures coming from all directions. Anyway, so Andrew's encouraging all staff to consider saying thank you to your leader for showing integrity, grit, humanity, and creativity in managing a work environment none of us trained for or could have imagined a year ago. Leaders are human too. I've heard that rumor as well, and need our compassion and gratitude. Thank you all. Thanks, Andrea. Very nice.
Good stuff. So we're at time. I think the recognition that leaders are human too is a great place to leave things for today. Maybe we can agree to convene again in the week ahead. I know that there'll be tons of information coming out of the vaccination process and other places on other projects as well. We'll continue to hold town halls as often as is needed to keep everybody informed. So thanks for everything. Rob, any closing remarks from you?
Yeah, I'll just once again thank everybody for coming, and thanks for all the hard work. I keep saying it's a funny time where on the one hand, we're kind of in this very hopeful effort of getting the vaccine out, both to HHS and to our community. But on the other hand, we know we're facing some very deep valleys in the couple of months ahead based on what the virus seems to be doing. So anyway, hang in there, everybody. Thanks for all your hard work, and you should know it's noticed and very much appreciated. So thank you.